Carolyn attended the PINC Cancer Rehab Program during her treatment for breast cancer.
I had surgery, a mastectomy, a reconstruction at the time of the mastectomy. Then I had to go and have more surgery, which meant they removed the implant that they'd put in. Then I also had to have my lymph nodes taken from under my arm, and that, I think, upset some nerves down my arm. And then radiotherapy probably contributed to the problem. And then gradually, over the space of 2 or 3 months, the whole thing just started to seize up, and I got cording up my arms, and it all looked sort of tight and pulled right down to my wrist. Yeah, it just sort of got worse and worse, and I was beginning to wonder whether I'd always be like that. Well, immediately she reassured me that she'd be able to help me, which was amazing, because I went in there thinking no one would ever be able to fix it. It was awful. I just thought this is, and I'd even read things on the internet about women who'd got the same symptoms as me, and that there was nothing that anyone could do. So I was convinced no one would be able to help me, but I thought, well, I'd better go. I'd been given a pamphlet at some point during all of my hospital visits. I've got all the information about it, so I thought, well, I'd better go, because what have I got to lose? So she was very understanding, and she said, I will be able to help you. It will take time, and you will have to do the exercises I tell you to do. And I had 10 weeks on this program, I think, 10 weeks. So we just decided we'd have a go and see what we could do. It took a while, it took a few weeks, but after a few weeks it began to improve, and then once it began to improve really quickly. And by the end of the 10 weeks I was pretty much back to normal. I went from only being able to move my arm up to about here to being able to move it right up and out. So it was a miracle.
So did your physio do manual things as well as exercise? What?
Yeah, she did. We did a lot of just crawling arms up the walls, those sorts of exercises. She did a lot of massage to move the lymph up my arm. She even massaged. I was so tight around this area here that I had a skin graft to cover where I'd had surgery, and that was very tight, so she did a lot of work there. Yeah, so that was really helpful and really nice. It just felt like somebody really understood what I was going through. So I don't know, maybe that even in itself helped me to start recovering. Yeah, but once I'd started to feel the benefits of it, it very quickly came right, but I do think that you really need to do the exercises they tell you to do. It's really, really important that you do properly follow, the exercise routine that they give you. Well, at the end of the 10 weeks, I didn't really want to stop. It was obviously so beneficial, and I remember saying to her, well, what happens now? I don't really think I should stop, because I thought I might seize up again. So she said, well, no, you can continue. We've actually just started a class in Hawke's Bay that you could go to, a pink Pilates class in Napier, where I live. So I started going to those, and I met lots of other women who had just finished the same sorts of things as me. There was about 6 of us, and we all did it for about a year. All of us did a class together, which was amazing, because it was really doing more of the same things that I'd already been doing. And it kept me going, kept me physically going. It kept me open across my chest, it kept my arm moving, and I got stronger and stronger. And at the end of that time, I was going to have my reconstruction done again. So then I was thinking, well, I need to keep this going because I want to be physically fit to have this surgery. And I learned a lot about my body and about my core and about things I didn't know existed before that really helped me when I came through my next surgery. Because I'd had a lat dorsal reconstruction, and it was very painful. difficult to move around. But once I'd had that information about using my core to help me lift and stand, and that had really helped me to recover afterwards. So I would definitely recommend that if you've just had surgery for breast cancer and that you're having issues with your shoulder or your arm, that it would definitely help you in some way, whether it would be to the extent it helped me. I don't know, everyone's different. So I think you've definitely got to give everything all the opportunities that you're given, you should definitely explore. And for me, it was 100% success rate, and I would do it all again if I had to. Yeah.